Now we'll get back on track and address our last subcortical brain region, the basal ganglia. So the basal ganglia is kind of a group of structures, and it can be kind of hard to identify. So I've included a lot of different images here, and also they're just kind of beautiful. So we're seeing the globus pallidus is part of the basal ganglia, sorry. It's this kind of bilateral structure. The bilateral structure here, sorry, is going to be the hippocampus and the amygdala, and it's going to be right kind of in the center there. So it's going to be located here in the brain, and if we kind of zoom in, this is really probably the best picture. So here we're seeing the basal ganglia, and it's going to be this kind of purple blob here. We're seeing the globus pallidus, which is going to be part of the basal ganglia, and then these kind of more internal structures here. It's got these little internal layers. And here we're seeing the reticulum, but then we're going to see the basal ganglia in pink. So let's zoom in. So the basal ganglia is a group of subcortical structures located deep within the brain. It forms interconnected loops or circuits with motor, cognitive, and reward areas in the brainstem, which is going to be down here, thalamus, and cortex. It supports movement, learning, decision-making, and ensures smooth motor function and behavioral regulation. It coordinates voluntary movement, procedural learning, reward processing, and habit formation, including reinforcement and addiction and craving. So we kind of talked about how this one brain region is really responsible with movement and reward. And we're seeing here the different kind of parts of the basal ganglia. Just showing another image here, we're seeing here's the thalamus, and these are kind of showing some of these connections. So here we're seeing the thalamus, motor areas, and the cerebellar loop here. And then here's going to be the basal ganglia and the basal gangliar loop from the thalamus to the motor cortex and back. And here, again, we're seeing the basal ganglia, and we've got a basal ganglia loop. We're seeing it go down to the brainstem, and then kind of these other projections as well. So the basal ganglia has several different brain regions in it. And one that we've already addressed is the dorsal striatum. Remember, we talked about in the dorsal striatal dopamine pathway, dopamine is synthesized in the substantia nigra and projects to the caudate nucleus and the putamen in the dorsal striatum. So the caudate nucleus, which is going to be right here, is associated with learning, goal-directed behavior, and motor planning. The putamen, right here, is going to be associated with movement regulation and refinement of movement along with the caudate. The global pallidus, right here, has an internal and an external component associated with helping inhibit or stop, prevent excessive movement, and signaling modulation within basal gangliar circuitry. So really helping kind of put a pause on our movement so we don't have hyperactivity. The subthalamic nucleus, which we're going to see that right here, is associated with initiating motor or movement. And we tend to see dysfunction here associated with Parkinson's disease. And then again, the substantia nigra, which we already kind of talked about here. And let's find that right here, this kind of purple area. The substantia nigra pars compacta, sounds like a little rap, produces dopamine as well as the ventral tegmental area that's critical for motor function. And the substantia nigra pars reticula helps regulate movement through inhibitory signals. Oh, shucks. Okay, and this is just showing another figure. So if we take a slice of the brain here, we're just going to look at the basal ganglia in a little bit of a different way. So imagine we're taking a slice of the brain where we're seeing these two light blue kind of dots. And now we're looking at the inside of the brain. And this is often how we see the basal ganglia show up. So here, and let me see if I highlighted these. Yeah, so here we're seeing the caudate nucleus, which is going to be right here. The putamen, associated with movement regulation, which is going to be here. The globus pallidus, and you can kind of see there's little two triangles here. It's going to be the internal and the external. And we're kind of not seeing that one so much on that other figure. The subthalamic nucleus, which we're not seeing, and then the substantia nigra, which are going to be these two little dots kind of bilaterally on either side here. Another way to look at the substantia nigra, if we kind of were to take a little section here, we'd get something like this. So that's the substantia nigra. There we go. And we're going to see the pars compacta in purple and the pars reticula in green. So we've already talked about the dopamine system a little bit, but I just wanted to give a plug since the dopamine system is really inherent to the basal ganglia. So the substantia nigra right here is one of the primary regions of dopamine synthesis in the nigrostriatal pathway where it projects to the dorsal striatum. Here we go. Okay. And so coming back to this, just again, another view of the basal ganglia here. So we're seeing the caudate nucleus, the putamen, the globus pallidus, the subthalamic nucleus, and the substantia nigra is not shown in this one. Here again, the dorsal, the caudate nucleus, the putamen, the global pallidus, the subthalamic nucleus, and the substantia nigra. So once again, the basal ganglia associated with motor control and coordination, movement regulation, interactions with motor pathways that help regulate motor control. It initiates, coordinates, controls, and smooths out voluntary movement. And then it's also associated with reward processing and habit formation. So interactions with reward pathways help regulate reward-based learning or reinforcement, procedure and behavioral learning, and learning reward behaviors or habits or addictions. Associated with voluntary movement, procedural learning, reward processing, psychedelic interactions with the nigrostriatal dopamine pathway can impact reward system modulation. So it can impact reward processing and reward seeking. It can impact habit formation and behavioral flexibility, or cognitive rigidity versus cognitive flexibility. So we see neuroplastic disruption of rigid neural pathways, and putamen-mediated habituation can support behavioral change. So this is one of the ways in which psychedelics can help kind of break up more rigid, cognitive thinking, cognitive rigidity, and help support flexibility as well as behavioral change. And then we also see impacts on movement. So we see some acute impacts on motor circuits and coordination. We see the basal ganglia is associated with coordinating voluntary movement, procedural learning. We've kind of covered this. So jumping down here, we see some hypersynchronization with cortical activity, reward system modulation, and then habit and behavioral formation. I think I maybe forgot to delete this slide. So I just wanted to double click and show some research here. We're looking at a publication on psilocybin-induced changes in neural reactivity to alcohol and emotional cues in patients with alcohol use disorder, an fMRI pilot study. Now, I do want to make the point that this is a pilot study, meaning it's underpowered, so it has a very small sample. And I think in this case, let's see if we can find it, n equals 6. So they had 6 participants. So findings are not going to be they're not going to be fully powered to be statistically significant, but it can give us a good idea. And in this study, they put individuals with alcohol use disorder in a scanner, showed them alcohol cues or emotional cues after exposing them to psilocybin. And it looks like here, let's see. So this pilot study investigated psilocybin-induced changes in neural activity, so brain activity, reactivity responses to alcohol and emotional cues in patients with alcohol use disorder. Patients were recruited from a phase 2 randomized, double-blinded, placebo-controlled clinical trial investigating psilocybin-assisted therapy for the treatment of alcohol use disorder. 11 adult patients completed task-based blood oxygen-dependent fMRI. If you don't know what that means, don't worry about it. Approximately 3 days before and 2 days after receiving 25 milligrams of psilocybin or 50 milligrams of diphenhydramine. Visual alcohol and emotionally valenced stimuli were presented in block design. So these individuals had alcohol use disorder. They randomly received either psilocybin or diphenhydramine. They went in a scanner 3 days before receiving the psilocybin or the control. And in the scanner, they were shown images of alcohol and their brain activity was assessed. Then they interacted with the psilocybin or the intervention, and then they went back in the scanner 3 days later. And across both alcohol and emotional cues, psilocybin increased activity in the medial lateral prefrontal cortex and in the left caudate, which is part of the basal ganglia, and decreased activity in the insular, motor, temporal, parietal, and occipital cortices and cerebellum. So there's that cerebellum again as well. Unique to negative cues, psilocybin increased supramarginal gyrus activity. Unique to positive cues, psilocybin increased right hippocampal activity and decreased left hippocampal activity. Greater prefrontal cortex, which is that executive functioning part of the brain, and caudate engagement and concomitant insular motor and cerebellar disengagement suggest enhanced goal-directed action, improved emotional regulation, and diminished craving. So they had less brain responses that would suggest craving, and then their reports kind of corroborated that. So if we go through a PICO here, I should have started clicking here. If we think about what's the patient or phenomenon, the intervention, the control, and the outcome, we're looking at the intervention is psilocybin-assisted therapy for alcohol use disorder, and we had an N of 5 to 6. They went in an MRI, fMRI, 3 days before and 2 days after psilocybin-assisted therapy, and they were given 25 milligrams of psilocybin-assisted therapy, or diphenhydramine, which is an anticholinergic. Acetylcholine is a primary neurotransmitter in the brain. Antihistamine, deliriant, hallucinogenic at a high dose. It's not serotonergic or mystical. So they're kind of using this as a control. They were shown images of alcohol and either positive or negative emotions when they were in the scanner after psilocybin-assisted therapy, and then the changes in their brain were recorded. And so here we're seeing fMRI images of the brain. Here we're looking at the brain from the side. Here we're looking at it from the back. And here we're looking at it from the top. And in A, we're seeing that psilocybin-assisted therapy increased coordination and neural activity in the left superior medial prefrontal cortex. It's that part of the brain associated with executive function. And in the right ventrolateral prefrontal cortex, still in the prefrontal cortex here, and left dorsal lateral prefrontal cortex. As well as, here we go, in the bilateral caudate in the basal ganglia. So we're seeing, remember again, red tends to indicate increases, blue tends to indicate decreases. So increased activity in the basal ganglia, which correlated with reduced craving. Zooming in there. And then psilocybin also decreased activity in the right insula, Here's the anterior insula right here, as well as in cortical motor areas and in the cerebellum. So increased activity in the basal ganglia associated with movement, but decreased activity in these other brain regions associated with movement, the cortical motor areas in the cerebellum. So overall, psilocybin increased brain activity and connectivity in the prefrontal cortex and more connection in the basal ganglia in response to alcohol and emotional cues. And that was associated with increased executive function, increased reward processing, increased emotion regulation, and increased inhibition and self-regulation. And then psilocybin also decreased brain activity and connectivity in the insula, motor cortex, and cerebellum. Together with the increases above, this was all thought to improve goal-directed action, emotion regulation, and reduce craving. All right.